Hey, Tenakoto, Markie here with part 2 of my series on psychotherapy and what it's all about and the different kinds of psychotherapy. So what I am conscious of is that I usually start these videos wearing my glasses and then I take them off kind of about now. And I'm seeing this through the viewer's eyes and thinking, oh, that probably looks like an affectation. And like I'm trying to kind of do a sexy Miss Moneypenny, kind of take the glasses off and wave and let the hair loose. And so that's been overly self-conscious here. Vlogging does that to you, I guess. But what that's about is when I set up the camera, I actually use an iPhone to record these. I need my glasses on to adjust all the settings, and then when I want to record the video, I want to remove my glasses. I've got to remove any kind of barrier between you and I, even though I kind of feel like I'm not making eye contact with you because the way the camera works, my eyes go off in a sort of funny direction. So anyway, that is beside the point. Focus, Markie. So we're going to talk about different schools of therapy. In the introduction, I started to talk about psychodynamic therapy, so we'll recap on that and what we said before, and give you, like I say, a thumbnail sketch, a kind of a brief idea of what that looks and feels and tastes like. So we talked about Freud, and we talked about how it was the first psychotherapy. Before that, there were people that listened and talked and provided support. Priests, would provide support and that kind of thing. So a lot of that was done through churches and things like that. But it became kind of part of the health profession, if you like, with Freud. There was psychiatry before then, but psychiatry was kind of very different, and as it is today, psychiatry is a different thing. Perhaps it might be useful to let's go off on another wild tangent here, okay? Because people often ask me this question. So what is, Markie, they say, what is the difference between a psychiatrist, a psychologist, and a psychotherapist, and a counsellor? And then sometimes they ask me what the difference is between all those things, and a social worker. So we may not get into the social worker thing today, but let's quickly go through all the P's or all the sighs. I can hear you sighing as we speak. So a psychiatrist is a doctor, so a medical doctor. So they have full medical training, and then they specialise in psychiatry. So they will be trained, in mental illness, and they will be very up on medication, and they can admit people to hospital and things like that. So some psychiatrists will also be psychotherapists, not all, and they could be psychotherapists in different schools of psychotherapy. But they will, even if they're not strictly psychotherapists, they can diagnose, they can provide talking interventions. So it's not just about medication. So a psychologist is somebody that has done a doctorate in psychology. And there are different kinds of psychologists. So there's kind of, I can't remember what they all are. The ones that kind of come closest to psychotherapists are clinical psychologists and counselling psychologists, and they can diagnose, they can treat. Psychologists and psychiatrists won't necessarily have had any psychotherapy themselves. Where psychotherapists train in the pure art of psychotherapy. Obviously that involves learning a lot of psychological theory, but it's a very practically skills-orientated training. And a good school of psychotherapy, not all, but a good school, and particularly the psychodynamic, psychoanalytical ones, involve lots of personal development. So some psychotherapists, like a psychoanalyst, for example, will have had a very, very long training, sometimes about 7 years, and they will have had intensive psychotherapy themselves, sometimes 4 times a week for an hour or for a 50-minute hour. So that's kind of pretty full on. So there we go. So that's psychologist, psychiatrist, psychologist, psychotherapist, and then there's counsellor. Now the boundary between counsellor and psychotherapist is well, I think it's less clear. This depends on who you ask. I think if you ask 20 counsellors and 20 psychotherapists what the difference was, then you get 40 different answers. So it's less clear because some of these things aren't definitive. You know, there's no kind of government body that, certainly not in the UK, that says this is what a psychotherapist is, this is what a counsellor is. So there are certain schools that will use the terms interchangeably. So some schools will say psychotherapist, counsellor. My bit of paper says I am a psychotherapist, but I quite often call myself a counsellor as well. So counselling, that we'll come on to this because counselling often refers to a particular approach to psychotherapy. I would say counselling is a form of psychotherapy. Broadly speaking, counselling, you could say, is there are less interventions from the therapist. So it's more supportive, it's more reflective, it's more listening orientated. Whereas psychotherapy, the therapist kind of gets in there and rearranges the furniture a bit more. But lots of people would argue with that definition. That is an oversimplification. So I think what I would accept is that the difference between psychotherapist and counsellor is blurry. That's if you're talking to a therapist, ask them lots of questions and get into the specifics, and then you'll have a sense of what that means in these cases. Let's throw social worker in for good measure. So social workers are they learn a lot of the same things as psychologists and psychotherapists and counsellors, and in some countries their training involves a degree of counselling. So sometimes often people who are social workers will also be counsellors. Social workers are kind of trained they've got a very strong body of knowledge around the law and family dynamics and the ethics and risk assessment and safety and that kind of thing. So they're involved often with families, not always with families, but often with families. And often with things like placements, so where the abuse is taking place in the family and maybe a child needs to be taken into care. That's the kind of thing a social worker would do. They might also help elderly people by finding care placements or residential homes or nursing homes for them, that kind of thing. So that's a kind of a social worker. So a bit of a digression there, but hopefully an interesting one. Probably doesn't leave me much more time to talk about psychodynamic psychotherapy. So we will kind of call it a day here, I think, and then I will be back and I will talk about psychodynamic and psychoanalytical psychotherapy if I can contain myself and not go off on too many wild tangents. So Rangimarie, see you soon.